Okay. All right. Thank you all so much for your interest in coming to Lobby Day this year. It's certainly a really exciting day to be lobbying. I think as we've all seen, as I think we've all seen on the federal level, every single day there seems to be another attack on some of our basic democratic institutions. So this year it's absolutely critical that we're able to strengthen the democratic institutions that we have here in New York State, as well as boost a number of the other issues that are really important to the league. So it's absolutely a critical year for you to be at the Capitol, and I'm looking forward to seeing you all. So I've got a presentation, so let me jump into that. And okay. So, oh no, I want to start at the beginning. Hang on. I'm sharing the wrong presentation. Bear with me. This is the one I want. Okay. All right. So feel free to plug any questions or comments you might have in the chat. It's just me this afternoon, so I'll grab them when I see them. But there will be some time for questions at the end. As I said previously, this year we are partnering with the New York State BIPOC Democracy Table, stands for Black, Indigenous People of Color. A number of their priorities line up directly with our priorities as it relates to democracy and election work. And so we're really excited to have our message boosted by each other as we do this work. I also want to flag, and I will a few times throughout the presentation, that it's also May 6th is also the Lobby Day for Medical Aid in Dying, which has seen just passed in the Assembly, which is huge. And we're going to hear more from Barb, who will be talking about that. But there is a medical aid in dying rally at Barb. Is it last I heard from Corinne? It was 2:30. Oh, Barb, you're on mute.
Barb wrote me it was 2 to 2:30.
Okay.
The thing is, it would have been like around noon when the press really likes to have a press conference. But the Senate is having their pictures taken tomorrow afternoon, and that's why I think it's for 2:30, but we'll see.
Okay. All right. Well, we will keep you all apprised of the exact time of that rally so that if folks want to join that rally, we certainly encourage you to do so. All right. So on the call this evening, I'm going to do a little refresher for people about the intro and the basics of lobbying. We'll talk about the agenda for May 6th, and then we're going to walk through some of our priority bills. I'm going to talk about election and democracy bills. And then we have a number of our issue specialists on the call who are going to talk about the priority bills for specific issue areas. And then we'll have a few, probably like 10 minutes at the end for questions. If you got to jump off, that's okay too. If you have any questions, just shoot me an email. All right, so on May 6th, we are, it's going to be a lot of moving parts on May 6th. We're trying out a few new things and we're going to see if we like them, and we're going to see if we don't like them. So instead of meeting at the Blake this year, we are definitely going to be meeting up at the Capitol. We are hoping that by meeting at the Capitol, it will make it a lot easier for folks to convene and then to disperse and go lobby without having to walk up the hill to the Capitol. So between 10 a.m. and 11 a.m., we ask that you arrive at the Capitol. We're going to be meeting in room 713A, which is Assemblymember Walker's conference room. I would encourage you all to get there as on the early side. Tuesday is a huge day for lobbying, and especially because we finally expect the budget to be finalized next week, it will be a very busy day up at the Capitol, which means that the lines for security can be quite long. So I will send you all follow-up information over the weekend that will include some additional details on how to enter the building, where security is. I'll also include my phone number so that if you have any questions as you're on your way in, you can feel free to give me a call. From 11:15 until 12:15, we are going to do a press conference, which we haven't done in a little while, but getting everybody together is a great time to really highlight the league's presence up at the Capitol and to let our voices be heard on, especially on issues like democracy issues. So we've invited a number of legislators and assembly members to join us at this press conference. We'll be joined as well by the folks from the New York State BIPOC Democracy Table, which includes groups like the NAACP, Citizen Action, the Brennan Center, and the New York Immigration Coalition. So we're going to have a press conference from 11:15 until 12:15. From 12:30 until 1 p.m., we're going to disperse, and we've got a few lobby meetings set up, and I know that some of you have lobby meetings set up as well. We're going to offer lunch back in Assemblymember Walker's conference room from 1:30 until 2. Lunch is going to be kind of, it will be available for you at 1:30, and so you can come and get it whenever makes sense for you and your schedule. And then from 2 until 4 or until the rest of the day, we're going to continue to lobby our representatives. I've heard from a number of leagues, I want to say 4 or 5 leagues that have set up their own lobby meetings. If you have not set up your own lobby meetings, not to worry. We have set up a number of lobby meetings with the BIPOC Democracy Table, and I can plug people into those meetings if you're interested. Attending a lobby meeting does not mean that you have to be the one lobbying all the time. This is really a great opportunity, especially if you've never lobbied before, to tag along and get an idea of what a lobby meeting looks like. We'll have a series of lobby teams set up, and each team will be led by someone who has done a ton of lobbying, like myself, or we've got a number of other leaders. And so these folks know what they're doing. They'll make sure you feel prepared before you go in the room, and you can also just sit and listen and watch. But I would really encourage folks to attend as many of these lobby meetings as you can. You can always, as we've done in years past, you can always go to the gallery and watch session as well if you'd prefer to do that. All right, so that's a little bit about what our agenda on the 6th will look like. As I said, more details and information to come over the weekend. I want to do just a little refresher course on how to prep for lobby meetings. So our post-budget lobby packet is a little delayed because the budget is very delayed. So I've finalized it today, but a few of the bills that are in there, we may see included in the budget. We just don't know yet because we haven't seen all the budget details. So you're gonna have to be a little flexible with me on that one. But once I send the post-budget lobby packet out, you just make sure that you take a look at it before heading to these meetings. Each bill will include additional background information, whether it's memos of support or memos of support from other coalition groups that we work with. Take a look at those memos, really make sure you feel comfortable with whatever the topic is that you'd like to be talking about. Keep up with the news. If you want to talk about medical aid in dying, make sure you know that it passed in the assembly last week. Make sure you know kind of where a bill sits and where a bill is at. The post-budget lobby packet includes all of that information for you. Hopefully, we're not going to see a huge change from today until Tuesday. So you should be all set with that information. When you get in there, and this is something that you can talk with whomever is leading your lobby meetings about, is what do you want the meeting to look like? Who's going to say what? And how do you want to structure that meeting? So typically the way that I do it, if I'm going with a bigger group, is as soon as you get in, you'll just do a round of introductions. This is a key time when you can highlight if you're a constituent of that area or you're a constituent of the member. That's something that offices really like to know and is really important. Then you'll choose someone in your group to kind of walk through why you're there, the importance of the bill, maybe some key data points or key talking points behind the bill, and then someone will do an ask. So what are you there looking for? The majority of the bills that we're working on, the ask will be for the member to co-sponsor that piece of legislation. If the member is already co-sponsoring that legislation, you'll want to encourage them to push for it in committee or push for it with their colleagues in other spaces to get the bill to get a little bit more traction and kind of move ahead faster. You can, if you've got time, you can always rehearse. I always rehearse the ask because the ask is the most important part. You want to say it with confidence. You want to use down tones. And so sometimes I'll rehearse that ask, but it's good just to feel comfortable talking about these topics. Aren't topics that most of you are talking about all the time. So it's good to, you know, whether you're in the car on the way up or you're walking from the parking garage to the Capitol, just talk about the ERIC bill out loud. Try to just get comfortable using the language that you would use when talking about that bill, so that when you're in a lobby meeting, you feel more comfortable. Day of, you always want to try to get there a few minutes early. If you have back-to-back lobby meetings set up, which a lot of you do, you might want to have a plan A and a plan B. Plan B is if our meeting is running late and we're running, you know, pretty tight to when our next meeting is, you know, you might want to split up and have some of you kind of excuse, you know, you never really want to excuse yourself from a meeting, but if you think that meeting might run long, you might want to split your team up and then have one half of the team go to the one meeting and the other half of your team go to the next meeting, if that makes sense. Yeah, it kind of hits on the next bullet. Be ready for delays. It's rare that a meeting will go over, but it's very frequent that there might be delays in the office. So you might get there at 2 and you might not actually sit down with someone until 2:10. This section here is key. You are in a very public space when you're in these offices. It is, you truly never know who you are walking by. You don't know who's in the elevator with you. You don't know who is the chief of staff for Andrea Stewart-Cousins. You don't know who is on the speaker's team. So just watch what you say. Just be appropriate. I know that you all will, but this is just a key reminder that even if someone doesn't look familiar to you, they could hold a very important role. And that includes when you're in the waiting areas of these offices. This goes, you know, again, into some of the things I already noted. You'll give your pitch and then you'll give your ask. This is a suggestion. Actually, some of these are from our US folks, and our US team suggests that you do not take notes whatsoever, and that when you leave the meeting, you like kind of, that's when you can scribble your notes down. I agree with that advice, except in this instance. I think if you're going on a lobby day and you have 5, 6 people in the room, I think it's okay if you have one person taking notes. If I'm meeting with someone individually or there's just 2 of us, I won't take notes then. I want them to know that I'm engaged with the conversation and, you know, listening, and it makes it feel more like a conversation and like less of a report out. But if you have a lot of folks, someone can take notes. That's not a big deal. Ultimately, if you're meeting with a staffer, what you really want to get at is you want to know what the member thinks. You want to know if this is a piece of legislation that the member could support. So you can ask a question or you like kind of try to get at that when you're meeting with the staffer. Oh man, I'm running a little short on time, so I'm going to keep this short and sweet. The only thing I'm going to highlight from this slide about making the ask is using personal stories. Far and away, that is the most effective way to to ensure that a lawmaker or their staffer is listening to you is by telling a story that affects how the issue has affected you personally, especially if you're a constituent in that area. That is a key thing that folks are really looking for. So personal stories are very compelling. After you leave a meeting, you want to email the staffer or the legislator, thank them so much. Report out to the rest of your team. I will have a link that you can report out how your lobby meeting went, a little Google form. And then just kind of keep your eyes open, look out for emails from the staffer, look out for additional information on the bill you were talking about, and then go back and do it all again. All right, so we're gonna shift gears now and talk a little bit about the bills that we're going to be talking about on Tuesday. So we're gonna talk first about elections and democracy, and I think I've got Kate on with me, right?
Yes, I am here.
Okay. All right, Kate. We have Kate, feel free to fill in anywhere I'm missing, but no pressure here. Kate is our elections specialist, our elections issue specialist for the New York State League. So the three key democracy bills we're going to highlight this year are ones that we have been talking about for a little while, but these are all bills that are really gaining traction and have a shot at really picking up some steam here. These are also really critical bills for kind of where New York State is in terms of election law. So the first being the ERIC bill. So the ERIC bill would allow New York State to join a multi-state voter database system, which would make it much, much easier for New York State to keep our voter rolls clean and tidy. And it would also indicate if a voter has, for example, left New York State and moved to Massachusetts, it would flag that much faster for it would flag that in the system so that boards of election across the state could cut down on some of the administrative burden that they take on trying to clean the voter rolls themselves. It would also identify spaces in New York where that are kind of like gaps where people might, it can highlight areas where more voters need to be registered or where we could kind of target voter registration across the state. It's essentially just a centralized, streamlined way to keep our voter rolls clean. Right now, they're managed by each Board of Elections separately. And there is a centralized state database, but it's not very frequently, it's not the same as what counties are holding on their end. And we've talked to many county boards who have said it's just very difficult. It's very difficult to make sure that they are up to date, and it's very difficult to make sure that their database matches what the New York State database has. So the ERIC folks have been doing this for a long time, and this would really help, again, streamline that process. This bill's passed in the Senate, and it just needs to pass in the Assembly. We were very, very close to getting this bill passed last year. And I feel very strongly that we will hopefully see it passed this year, potentially in the budget. But if we don't see it in the budget, then we're going to have to really push hard to make sure that it's one of the bills that gets through before the end of session.
And it has a very small fiscal impact. It's just a very small membership fee, I believe somewhere in the neighborhood of $50,000. Is that right?
Yep, that's exactly it.
And the reward for that $50,000 will be enormous. It's cleaning up the rolls. Voters have more confidence if they think that there are not dead people on the rolls or people who moved years and years ago, or sometimes people believe that voters are voting in more than one state. That sort of thing is taken care of in ERIC. So it's I personally don't think there's anything bad to say about this bill.
And to Kate's point, we haven't seen a lot of opposition to this bill. If anything, it's just that folks do not know about it. I'm speaking with a number of Republican legislators outside of the election committee hearing where this bill was moved forward in the Assembly. And they all said, we're just not really sure what it's about. And when I walked through it with them and was able to explain what the bill really does, everybody was on board. And this actually passed out of the election law committee with no opposition.
In the assembly, it passed out. We're just waiting for it to come to the floor now, right, Erica?
Yep. Yeah, exactly. Go ahead, Ramona.
One quick question. Who runs that operation so we could be aware? I mean, who has this business or whatever it is?
Oh, it's ERIC is the name of the business. It's the Election Registration Information Center.
Okay,
Yeah.
but
I
who
don't
is
know
that and where are
It
they?
is. Do you, Erica? I don't know physically where they live. Do you? It's a great
Oh,
question, Mona. I like the question.
physically, I don't know where the organization is based. I could look it up.
So
There's a
there's
lot
no
of
question, there's no question about the viability of this group doing it. I mean,
Oh, no, they've been
nope.
around.
There's over 25 states that are a part of ERIC, including DC, so 26.
okay, that's what I was looking for. What is the justification and verification? Okay.
Yeah, there's a
thank you.
number of states that are members of ERIC, and that's why it works so well, because it's easy because you have the states bought in, so it's easy to track when voters move across state lines. There is they've also done a good deal when it comes to security. They've done a lot of work when it comes to ensuring that the system is secure. And there's more information on the ERIC website about how and why ERIC is so secure. One of the main reasons that New York State elections are secure is because they're so disparate. So everybody does it differently, and that's why they're secure, because if someone wanted to hack the system, they would have to go into each and every county's database separately. Right. But this has that was kind of the first one of the, their top concerns, and one of the things that they highlight is the real security of the system.
There's some very helpful information in the chat, Erica. I'm looking at it now. Judy Estequist has listed all of the states who are currently members, and our wonderful Laura Bierman said the mailing address for ERIC is Washington, D.C.
I thought it was D.C. I wasn't sure. Okay.
I just looked at the security issue on the website, and that is a mailing address only. Each state that's a member gets a member of the board of directors, and they have remote sites, and all the servers are in the US, and nobody knows where they are because they're secure.
Well, that's good.
Very good. This is great background. That's great background.
I like that. The only objection that I heard in all my conversations and all my lobby visits was certain Republicans believe that it's going to juice up Democratic enrollment, because the bill does require that states make efforts. They make proactive outreaching efforts to register voters. But you're registering voters. You're not registering one kind of voter or another kind. You're registering voters. So,
basically what we do right now. I mean,
correct.
So yeah.
Correct. So another reason we love this bill.
I'm gonna go to Dare, and then we'll go to Doria, and then we'll go to the next bill. Go ahead, Dare.
And Kate may have just answered it. I know some states have withdrawn from it, and I didn't know what that whole thing was. Is that the only thing you've ever heard?
It was I read about it. It's the Republicans convincing their constituents and their influencers that it was juicing up the roll. It would just be a way to juice up the rolls for the Democrats.
And it's a
That's their argument,
which is nice.
Right.
Nonprofit organization.
Yes. Yep. Go ahead, Doria.
Hi, Erica. Can you just clarify again the status of the bill? I'm not sure where it's gone through and what we're waiting for.
Sure. So it passed through the Senate, and then it made it through the Assembly Election Law Committee. And so now we are just waiting for we're pushing for it to get to the floor on the Assembly.
Okay.
For a vote.
All right. Thank you.
Yep. And a lot of what that is it's about showing the Speaker Hasty, that there's support, and that there's support behind the bill, and that people want to see it moved. So adding things like co-sponsors helps to do that, and also asking for folks to advocate for this in committee also helps to get it to the floor. The other bill, the next one we're going to be talking about with folks is I don't want to call it an oldie but a goodie, but this is something that we've seen before. So we are back at it with same-day voter registration. So same-day voter registration was on the ballot in 2021. As we all know, it did not pass. For a number of years after that, legislators were not they were not excited about picking it back up. They thought, the voters have voted it down. There just wasn't a lot of appetite to pick it back up again. But this year, we've absolutely seen that change. Every day I look at the bill, the co-sponsor list is growing and growing. I think that the Senate has a list of maybe 20 co-sponsors and some pretty big hitters, some pretty big leaders in the Senate, and the Assembly side is growing as well. So this is a bill that's sponsored by Senator Gianaris and Assemblymember Carroll. It would essentially eliminate, right now, it's a constitutional amendment, not a bill. It would essentially eliminate, right now in our state constitution, there's a 10-day gap between when someone has to register to vote and election day. And this would eliminate that so that someone could register to vote and vote on election day. This is something that many other states have. 23 other states already have same-day voter registration. It is something clear, easy, and we know it's something that we can do in New York State already. In the last few years, a bill was passed to allow for that time between when someone has to register and election day to be reduced from 25 days to 10 days. And that 10 days means that there's now a gap, an overlap between the early voting period and the last day of voter registration. So there is one day in New York State called Golden Day where you can register to vote and you can vote on the exact same day. The rollout of that process went incredibly smoothly. There were no major hiccups. The process that's currently used is that if a voter comes in on that day, they're not on the rolls, or they're registered in the wrong county, whatever that might look like, they're able to vote via affidavit ballot, which registers them to vote. And then that's also how they submit their ballot on the day of. That's then both their registration and their ballot are looked at, on the back end by the same way that anyone else's registration would be looked at by a bipartisan team of election officials before it's counted along with the rest of the ballots. So because that process was so smooth and that counties are doing it all across the state, there's no reason that we shouldn't be able to adopt this for our typical election day. Every single year, the past few years, the league has been working on the election protection hotline. And every year we get countless people calling up saying, I went to vote. They told me I wasn't on the voter rolls. I haven't registered yet in New York, and I thought I could do it at the polls on election day, but instead I was turned away. These are people who are excited to vote. These are people who want to take part in the democratic process. And whatever issue they're having with their voter registration could be solved right then and there so that we can have as many New Yorkers participating in our elections as possible. Straightforward and simple, truly one of the heart of the league, right, is that a democracy is not a democracy unless everyone is able to participate. So this is something that needs to pass in this legislature, then it needs to pass once more in a separately elected legislature before it gets on the ballot for voters. Something key to highlight here when talking with lawmakers, if they ask you, hey, people voted it down in 2021. People voted it down in 2021 primarily because they did not understand the question on the back of the ballot. Last year, maybe 2 years ago, a bill was passed called the Plain Language Bill, which ensures that all amendments on the ballot need to be written at no greater than an 8th grade reading level. This will hopefully mitigate any issue with voters not understanding what a ballot measure means moving forward. So hopefully with that clarity, we expect to see general support for this bill. I don't want to misquote anything, but I think, and Kate, maybe you remember some of the stats from before, but by and large, the majority of New Yorkers support same-day voter registration. I see Kate nodding.
Yes, that's true. They don't necessarily like affidavit ballots, but they
right.
But they like same-day voter registration.
Exactly. Okay, the last bill that I want to talk about, I'm running out of a little time. The last bill I want to talk about really quickly is democracy during detention, which has also gotten it's building co-sponsors by the day, and it's something that leadership is talking about. This is again a bill that would ensure that our democracy is working as it should by allowing each and every voter to have access to the ballot. So as you all may know, within the past few years, the League did a study where we looked at jails and the ability to vote in jails for people who are detained across the state. 46 out of the 56 counties that we surveyed had no program in place to ensure folks who were detained had access to the ballot. This is thousands of New Yorkers each and every year who are denied the right to vote, not because they've lost that right, but simply due to process. They don't have the ability to have access to the ballot when they are detained for several reasons. The first of which is that it's typically up to the sheriff who decides if there is a program in place, if a community group like the League is allowed to go in and register voters, if the mail goes out on time, if the folks have access to a phone so that they can call and, call the League and ask us to send them an absentee ballot application. There are a number of reasons why it's incredibly difficult to vote while you're detained in jail. And that's simply not how this is, the denial of rights for folks who should not have these rights denied. So this bill would ensure that it essentially codifies a process to ensure that there is a process in place at jails across the state to ensure that people can vote, whether it be via an in-person absentee ballot program, like they're currently running in Ulster County right now, or if the jail decides, they could also have a poll site for some of the much larger areas in our state. So this would again codify that process and ensure that everyone has access to the ballot. I've gone over
Erica, can I just say that one of the
time.
things included in this bill, which has been ignored, that I think is really important, is that it specifically by statute says that every people who are incarcerated have the right to vote, save for those convicted of a felony. We know they do today, and I can explain why, but the reality is that nothing that says it, and this would say it, and I think that would really help.
Thank you, Richard. I really appreciate that. That's absolutely right. And to piggyback off of that, what this does is it takes this process out of the hands of sheriffs and corrections officers, and it puts the process back in the hands of our boards of elections. Boards of elections run our elections every other place, whether it's at your poll site or whether it's in a nursing home nearby. They should also run elections in within our jail systems. So with that, I am going to quickly open the floor to do we have any other questions from folks? I see there's a lot of comments in the chat, so I will take a look at the chat. If we don't have any other questions, then I will hand it over to Kathy, who's going to talk to us about rural issues.
All right. Thank you.
I have a question.
Okay, look, you got a question.
Go for it.
I
Who
think
had
it
the
makes
question?
sense to bring in printed materials to hand out, especially nicely printed in color. Like it says, hey, we got ready for this. We prepared this. Put the member's name at the top and handwritten and say, please hand this to the member. And if that, like the New York Focus article I just posted in the chat, looks really good to me. If a good presentation of that could be made, it looks very independent. It's by two different Board of Election commissioners. It's about democracy during detention. It answers many of the questions that I have. And I think that it can have some impact to give them some nicely printed document.
Thanks, Bob. Thanks for sharing that article in the chat. I think that's really helpful. And this bill does include some language that would expand access to educational materials in jails for folks, because that's another huge issue, is that it's very difficult what people can and have access to inside in order to ensure they're able to learn more about what's on their ballot before they go vote. All right, so with that, I will hand it over to Kathy. Go for it, Kathy.
Yeah, are you going to share your screen with
Yes, yep.
slides? Yeah, just so, I mean, just remind everybody that you will be getting a lobby kit that will have a lot, we'll have all this stuff in writing. And so what I'm going to do is just kind of hit some highlights here from the materials that I submitted to the lobby kit. And I'm Kathleen Stein. I convene the New York State Rural Caucus. So I'm going to hit the highlights here of 5 bills. Anybody who heard my Hot Topics talk, a lot of this is going to sound familiar. Because several of these bills are bills that have passed before, were vetoed by the governor, but we're still pushing to get them. The first 2 have to do with childcare. One is what activists call it decoupling bill. This would amend New York's longstanding rule of tying childcare assistance to the parent's exact hours of working. And this rule has made it difficult for working people, including parents in a growing gig economy with fluctuating schedules, rotating schedules, that kind of thing, to access childcare assistance. According to a recent report by the Bipartisan Policy Institute, 1/3 of parents nationally don't know their work schedule more than 2 weeks in advance. This bill has passed both houses 3 times with bipartisan support, but has been vetoed by the governor each time. In rural areas in particular, which is why I'm sort of treating it under this heading, travel times to caregivers and to workplaces are often significant. So this bill would enable parents to receive assistance to cover the travel time as well, so that there isn't this gap. This should be an easy sell to most legislators, an easy ask, because it has passed before. Next slide, please, Erica. Oh, there she. Another child care bill. This bill would remove the requirement for minimum earnings to receive child care assistance. And you heard that right. Right now, there's a rule that you have to earn a certain minimum amount to get assistance. This requirement has made it difficult for parents, again, in the growing gig economy with fluctuating schedules, terms of employment, people who work part-time gigs, to access childcare assistance. Once again, it has passed both houses twice, the last time with unanimous support. Well, how often does that happen? And yet it was vetoed by the governor. Not only does this requirement hurt parents in the gig economy, but also it often denies assistance to parents who are small business owners who are barely paying themselves any money, and therefore it looks like they're making less than this minimum amount. In poor rural areas, enacting this law would be a lifeline for many low-income parents who work several part-time jobs or who work seasonal jobs. Again, given the unanimous support last time, this should be a pretty easy ask from virtually any legislator. Next slide. Now moving on to healthcare related bills. The local input for community healthcare. Again, it's a bill that has been reintroduced after having been vetoed by the governor. It requires public notice and public engagement when a general hospital seeks to close entirely or to close a unit that provides maternity, mental health, or substance use care. Across our state, but especially in rural areas, hospitals are closing down important services like maternity care, or are closing entirely. More than 40 hospitals in New York have closed over the last 20 years, 40 hospitals, and 10 hospitals have closed maternity services over the last decade. I mean, obviously these closures, hurt, medically underserved people in rural areas, but also people with disabilities, immigrants, people of color, etc. Maternity unit closures have created maternity deserts in many rural areas of the state, resulting in long travel times for someone giving birth or having a miscarriage, potentially endangering lives. In addition, closures of hospitals and hospital services can be economically devastating to small local communities where the hospitals are the major employers. Where I live now, one of our major employers is a hospital. Despite all of this, as of now, Department of Health guidance calls for only 90 days notice before the closure of a hospital and offers no guidance regarding the closure of a hospital unit. This bill would specify 270 days before the closure of a hospital and 210 days notice before a hospital unit and, require community input. Please urge legislators to support this bill. In many cases, urge them to support it again. Okay, next slide. This bill would expand healthcare services provided by telehealth by incentivizing providers operating in the telehealth space to provide services relating to mental health and substance use disorders, as well as for individuals with developmental disabilities. And they would do this by establishing new guidelines for reimbursement rates. Generally, telehealth services are entitled to be reimbursed at parity to reimbursement for in-person services. However, telehealth services provided for these particular issues are often not reimbursed at parity, and it's kind of decided by kind of not quite case by case basis, but each individual commissioners make these decisions. But this would pass a law that would make them fall under the same rubric. The bill itself mentions privacy and the comfort of getting some of these services from home. In addition, in rural areas, telehealth is a solution for people who lack reliable transportation so that they can access services. Also in rural areas, there's a shortage of mental health care resources and addiction services. So this would help those services go further by making it more accessible by telehealth. Next slide. And this last one, this is a little complicated. This is a little technical. This is a repealer. So this is repealing a law that was passed in 2020. This removes certain restrictions on eligibility for personal and home care services to be reimbursed under Medicaid. The current law governing Medicaid eligibility for personal and home care services defines as being qualified for Medicaid reimbursement individuals who need assistance with three or more activities of daily living, known as ADLs. For persons with dementia or Alzheimer's, they need to have assistance with at least 2 activities of daily living. Activities of daily living are generally defined as including bathing, dressing, using the bathroom, moving about one's home, housekeeping, and meals, whether that's cooking meals, eating meals, whatever. Again, in the lobby packet, there will be, there's an outside source, which I've included from the New York Association on Independent Living, that gives a kind of complete list and a kind of comparison of the new bill that was passed and what this repealer would be going back to. So this bill would restore the eligibility criteria before this 2020 bill was passed, which said you only needed assistance with 1 or more of these ADLs for home care services and consumer-directed personal assistance to be reimbursable under Medicaid. Now, so this is kind of complicated sounding, but the way to think of it is that clearly enabling people who are elderly and or disabled, enabling them to remain in their homes has many, many advantages. For one thing, it's much cheaper to the state, because we're talking about Medicaid, than they're being in a nursing home or an assisted living facility. But it's not only cheaper, it's healthier, it's safer. people have better quality of life. In some cases, people are able to have jobs and things, you know, they just need a certain amount of assistance, certain disabled people. So this, you know, this bill for equity of access to healthcare, we think this is an important bill, and especially in rural areas where we have a shortage of nursing homes and assisted care, this you know, would make a big difference. I mean, the difference that's been made by the changed law has not been a good one. So that's it. So any questions? As I say, I remind you, there'll be more in the lobby packet on all this stuff, not just my stuff, but everybody's stuff.
Oh, got a question from Ramona. Go for it, Ramona.
Yeah, I have a question again. Obviously, what is the reason that Governor Hochul has vetoed those particular bills regarding the health situation?
Yeah, it seems to be cost. Well, apparently the first time she vetoed the child care bills, she said, oh, these should have been in the budget. These are really budget bills. So they were presented then as part of the budget process the next time around, and she still vetoed them.
I'm just really curious because she's usually pretty hot on childcare stuff and families and stuff.
You should hear, the Empire State Campaign for Childcare, which is an excellent group of.
It's huge, yes.
They are, I think, furious would be the correct term.
Yeah, I'm just surprised. I mean, I didn't realize that she had that.
It's very baffling, and I just, especially the bill that was passed with unanimous support, I do not understand why they don't make a move to override the veto.
Exactly. Well, thank you. Okay.
What can I say? And the same with the hospital, the Community Input for Local Health Act. She claims that will cost too much money, that we just have to be able to close these hospitals more quickly or whatever. Speaking for communities in an area where we have had communities lose their hospitals and lose maternity wards.
Yeah. Yeah, well, we have had that, you know, happen in a lot of rural areas in Western New York.
Yes.
Counties. Yeah. And
I'm
so
way upstate, but yeah.
It's not an isolated situation. And
not
it's
at all.
Devastating for these communities.
Devastating.
Because they have nothing. Yeah. Okay. Yeah. Thank you.
Yeah. Good question. Thanks.
I'm gonna just jump in here. I'm gonna thank you so much, Kathy. That was wonderful. You stayed on time. I did not stay on time. So I'm looking at the time. I've made us late here. So in an effort to keep us on track, I'll ask that folks plug any other questions, either for Kathy or anyone else, into the chat, and folks can just kind of answer them as we go. I want to hand it over now to Barb, who's going to talk to us about medical aid and dying. Go for it, Barb.
Now that I'm unmuted, I'd be glad to speak to you all. As Erica mentioned, we had a very, very exciting pass for the medical aid and dying bill in the Assembly this past Tuesday. It passed 81 to 67, and there was a 4-hour debate because that's how much that the Assembly can allow on bills. And the process was really that, first of all, of course, the sponsor, Amy Paulin, who, as you may all know, used to be the president of a league in Westchester County. But she introduced the bill. There were people asked to be recognized to ask questions, then they get to speak on the bill. You know, and they pretty much alternated between Republicans and Democrats. Turned out that all the Republicans voted against the bill, which was not what our lobbyists had really thought, because there were some people who appeared to be voting for it, but we did hear that both the Catholic Conference and the and the Conservative Party did threaten all of the Republicans with primarying them if they voted for the bill. Now, that's just like scuttlebutt, but those are things that happen. And that's why when we were talking about why the speaker or the majority leader really only count Democrats when they're saying whether they want to bring a bill to the floor, is because they really need to have people who would be afraid to lie to them about what they're going to do. So that's why that tends to happen. So I wanted to, oh, where's my slides, Erica?
Oh, I don't think I got slides from you, Barb.
Yes, you did, because you said thank you.
What a busy time it's been. Hang tight. I apologize.
Well, if you
Uh,
don't have it, you don't have it.
Nope, I have it right here, Barb.
Okay.
I'm ready to share. Thank you for the reminder.
Okay, so I don't know. Can people read that? So the medical aid in dying bill only applies to people who are actually dying anyway. And they have to have two doctors say that they're within, to the best of their medical judgment, 6 months of dying. And then the person has to make a request of them first orally, then in writing. And then they actually get a prescription for the medication that they can take. An amazing number of people don't take the medication, like I think close to 40%. Partially, I think because they die before things progress that well. But this is the advantage of this bill. So this bill was modeled after the Oregon Death with Dignity Act, which is between 25 and 30 years in practice, and they never get any proven instance of abuse or coercion of the patient. So there are a lot of safeguards on this bill. Switch to the next slide. Oh, well, let me say this. The bill is S-138 because there's no sense now in bothering to mention your this bill when you're lobbying somebody who is an assembly member. They've either voted for it or against it. I will at the last slide have the link where you can actually find out how your assembly member voted on the bill. And then, of course, you should thank that person or express your disappointment. But right now, you're thinking about what does the senator do? And so this bill, the advantage is that it allows dying people to escape the pain and suffering that they often have at the end of a fatal illness or towards the end, and it allows them, if they're within those 6 months, to escape. It also allows people to die at home and to say a final goodbye to their loved ones, knowing which day you're going to die. People in other states where they have this, arrange to have their loved ones there so that they have support. And also a reason to be in favor of it is the poll by YouGov that found that indeed 72% of New Yorkers do support access to medical aid in dying. with only 23% opposed. And that really kind of support is across various demographics, including age, religion, and political affiliation. I think the only members of a religious group who don't in a majority support it would be the very Orthodox Jewish community. But even Catholics, even though their leadership is opposed, they pretty much have the same amount of support. And most people of course, want to say goodbye to their loved ones. And the medical aid in dying is supported by, like, I don't know, 45 organizations, including the New York State Bar Association, the New York State Academy of Family Physicians, the Medical Society of New York State, the Psychiatric Association, Statewide Senior Action, and the League of Women Voters of New York State. So it's a very well-supported bill. And one of the things that I have found out over this last year is that the most effective way for you to lobby your senator and the government, and also your assembly member at any time, is to send a handwritten letter or a handwritten note to their office. And of course, it's, great if you are a constituent. And then make your arguments, but you don't always have to make an argument. You just have to say personally that you support it and you want them to support it. And then I did put up here the link, and I'm hoping that the link will be to find out how your assembly members did vote. But the way that you can do that is to go to the assembly website and click on the legislation, which was A136, and then go to floor votes. So, and then it has the whole list of everybody. So with that, I want to ask you to please, if you don't have a chance to talk with your senator on Tuesday, to send that handwritten letter or note. So that's it.
Thank you so much, Barb. Barb, I put the link in the chat for everyone so they can click on it here in this meeting. And Nancy notes that you have guided this legislation for many years, and you absolutely have, and you've been a true force within the league to enable and empower league members to do this work right along with you, and we really appreciate it.
Well, the league studied this issue in 2017, and we went to the first only hearing on the bill that was held in 2018. So I've been working on it a long time.
You have, it's getting there.
It's personal to me too.
Thank you so much, Barb. I am going to hand it over to Judy, and then just so folks have an idea of our timeline here, it will be Judy, and then we'll have Richard will talk to us about criminal justice issues, and then I'll hand it to Beth to wrap us up. So hang tight, Judy. I've got your PowerPoint here.
You do.
And,
okay, I just put it up.
Oh, you got it. All right, that sounds
Thank
good.
you. You gave me a breather. Okay, so there are 3 bills that we'd like you to talk about, and 2 more just to put on the table. The New York Health Act, if you can talk about it, and not everybody can, we would like you to ask co-sponsors to advocate it for it to their constituents. And in the package, I put who the co-sponsors are so you can see if your guy's name is there. If you're really comfortable and your guy isn't a co-sponsor, and by guy I mean male or female representative or senator, then what you can do is is educate them about it. But if you're not comfortable about talking about the New York Health Act, you don't have to go there because it's not going to be brought to the floor this year. We just want to build more momentum among legislators who say they support it because we have a super majority of each. We have a majority of each who are supporting it. You need 32 in the Senate. We've got 33. You need, I don't remember what it is. So we've got it. The primary care spending bill is very important. So that would be the one that actually might pass. It has passed in both chambers before, and it was vetoed by the governor. What this would do, it would cost not very much. We would ask every health insurance company that pays reimbursements and, gets claims in New York to send a report to the Department of Health or to the Department of Insurance how much they spend on primary care. And a small amount has to be spent on defining primary care, but it's basically family care, OBGYN, pediatrics, geriatrics, and things where the doctor is the pediatrician or the nurse practitioner or the physician's assistant is the first line for seeing patients and who would then manage specialists and others. When primary care spending is up to something past 12%, what happens is cost goes down and health goes up. Or there are about 13 states that have decided to rebalance their primary care spending. Oregon is one of them. They were early, and Oregon discovered that for every additional dollar invested in primary care, Oregon saved $13 in other healthcare services. I know, it's just astonishing. But primary care is where you get prevention and health education and careful coordination of specialists and various other things. So we do not know how much New York spends on primary care. It is probably around 5 to 7% or less. And this bill would both first measure it and then give milestones for getting to 12.5% over the next 8-10 years. So it is built in, not that you spend more, but that you spend a greater percentage. And as you spend a greater percentage, the total other costs should reduce given the experience of other states. So this is a bill that would just make an enormous amount of sense around economics and around public health and around individual health. It does face the fact that our primary care providers are among the greatest shortages in New York State. But part of the reason primary care providers are in such shortage is because they also get much less reimbursement than others. So one way an insurance company could meet this is simply by reimbursing more, a greater amount per hour or per visit. That would raise their percentage. They would get paid for it. And that would bring more pediatricians, OBGYNs, and others into practice in New York State. This is a bill that everybody ought to be in favor of. In fact, it has passed previously, but it got vetoed, and I am told that why something gets vetoed is only that people on the inside actually know. The second bill that I could pass this year is the Hospital Transparency Act, which again has passed both chambers in the past, and the governor has vetoed it, most recently because it might cost $1 million, and rumor has it that it might actually be in the budget. Fingers crossed, we would still have to pass this bill again. What this one asks is for the Department of Health to collect from every hospital, or actually ask every hospital to send the Department of Health all the rule-based exclusions for care that they refuse to provide. So there's about 220 active New York State hospitals. There are about 50 or 60 that have probably more than just a few of these. And many of these rule-based exclusions include things like terminations, contraceptions, D&Cs to clean out a miscarriage, taking care of an ectopic pregnancy early before it becomes life-threatening. And they also include end-of-life care. So honoring advance directives about no extreme measures, honoring advance directives about no feeding tubes or ventilation machines or various things, so that when somebody says, I do not want these, the hospital is required to honor the patient's advance directives. These are written documents, typically that have been notarized, that are given to the hospital, and hospitals ignore them. I can even speak to my mother-in-law's case, where the Catholic hospital she went to, we were told, my husband was told when she came out of surgery and had explicitly said that if I'm being hooked up to a ventilator for longer than it takes me to come off it easily without an expectation of coming off of it, pull the plug. And the hospital said no. And my husband, the lawyer, and his brother, the lawyer, had to come in their lawyer suits on the day and day after that my mother-in-law had died, when they were in terrible grief and threatened to sue the hospital because she made it very clear to the hospital. They had advance directives. The surgeon knew, the surgeon agreed, and the fact that the hospital now apparently changed its mind was unreasonable and illegal, according to my husband and his brother. But it was really traumatic for them. And so reproductive standard care, you should find out about it before you're admitted. And apparently many people do, because if I need special care and I go to the emergency room, they admit me and then they tell me they won't give it. That's a problem, because I would have gone to a different hospital if I'd known. This is about choice and about autonomy, and it's about following New York State laws when the patient wants something that is legal and medically necessary, or something that is legal and the patient has in writing specifically asked for it, having a hospital say, no, our judgment's better than yours because of whatever reason. So this would collect all these rule-based exclusions, put them on a website that everybody could check so that they would know about it and it would be public. And it got vetoed. And part of me wonders if part of the reason it got vetoed is that if these rule-based exclusions were posted, it is very likely that many patients would not go to that hospital, because in case they needed something, they don't want to be in the situation of being admitted and then not being able to get it. So primary care, hospital transparency, and if you're comfortable talking about the New York Health Act, please do. The other two, one is a coverage for all bill, which would allow 154,000 undocumented immigrants in New York to get to buy into essential plan if they have either under 138% of the federal poverty level or under 100, I forget what the other one, of the federal poverty level. And the advantage of that to New York is that would give them primary care and doctors, rather than getting all their care at emergency rooms when it's a crisis. Because right now, New York State is paying for emergency room care for all these people. It would be cheaper and better for public health if we paid for regular health care and they could avoid emergency rooms. And finally, medical debt. There is Medicaid overpayment recovery in New York State, which is far more onerous than other states. It doesn't have due process or consumer protection. And in many cases, it harms the recipients when overpayment recovery should not harm people's well-being and put them out of their houses. That's not the point. If you're on Medicaid and some payment, you are only partially eligible for it or whatever else, and then getting it back harms you, that's not what Medicaid is supposed to be doing. So this is just wrong. Again, it's another one that's passed both chambers. Governors vetoed it. Right now, it only has 4 co-sponsors, but that's because I think the co-sponsors are all very involved with the budget, and they have not been following and pushing this as hard as they could have. But once we get a budget, I assume they will mobilize.
Thank you,
So
Judy. If folks have any questions for Judy, feel free to plug those questions in the chat. Oh, hello, I see some new faces. Hi, folks. The recording will be sent out so you can catch the whole thing later. I'm going to hand it over now to Richard Rifkin, who is the co-chair of our Criminal Justice Committee. And Richard's going to talk about a few bills, some of which we've also been advocating for a while, that are picking up some steam. Go for it, Richard.
Okay, I'm going to try to be very quick. I know it's getting late. This is a very difficult time for those working on criminal justice because politically there is just crime is just this enormous political issue. We saw it in the last election, which was so close because of the criminal aspects. We're seeing it in the city. And so therefore, these criminal justice issues are difficult. So we're trying to deal with it as best we can. I should note that we were opposed to changes in the discovery law, and that it looks like it's going to be taken care of against our will in the budget. So that's over and done with. We've got 2 bills dealing with parole, which we've been supporting now for a couple of years, and they may actually have a chance this year. One is called elder parole, and the other is fair and timely parole. Elder parole gives the right to a parole hearing for people who are incarcerated, who are 55 or older, and who have served at least 15 years. This does not mean they're entitled to be released. They are entitled to a parole hearing. And the other bill, and by the way, it's got Hoylman Siegel is the Senate sponsor, Davila is the Assembly sponsor. Fair and timely parole is a bill which fundamentally requires fairness in parole hearings. It requires the parole board to look at the individual's conduct during the years in which the individual has been incarcerated, rather than just looking at the crime that that individual committed, usually many, many years ago, and assuming the individual has not changed, so therefore they're not going to let the individual out on parole. Again, you get a hearing, but the hearing has to be a fair hearing where they look into the facts, not just into the crime. So both of those bills basically look at people who have been incarcerated for a long time, who have demonstrated that they are constructive individuals. We can see it from the time they spent, and why keep them incarcerated. Number one, it's expensive. And number two, it doesn't really accomplish anything. So we've got some hope for those 2 bills. We've got another bill where this year is the first year we've been supporting it. It's fairness and opportunities for incarcerated workers. Myrie is the Senate sponsor. There is no assembly bill at this time. And basically what that bill would do is create a state prison labor board for the purpose of assuring fair compensation for the work and labor that's performed by incarcerated individuals. It allows them fundamentally to earn a reasonable amount for the work that they do. I suspect no assembly bill yet. This is a fairly new bill. I don't think that's for this year, but it's one we ought to start to focus on. And the last thing I just want to mention is the issue of the HALT Act. This is the bill which passed a number of years ago, which puts very significant limitations on solitary confinement. It was a very, very important act when it was passed. There is now pressure on the governor to loosen some of the restrictions. I can't say I oppose any single change in the bill because you have to look at the bill, and there's no bill. This is just in the discussion stage. But there is concern that this is going to come up at some point before the session ends, and we should be looking at it very, very carefully, because if there were a significant change and a significant loosening of the restrictions in the HALT Act, I think we ought to be very much opposed to that. So that's where we are from the criminal justice area.
Thank you so much, Richard. And as we've said earlier, we'll be following up with the post-budget lobby packet, which has all of this information and more in it, so you don't have to memorize it all. Thanks, Richard. All right, last but certainly not least, I'm going to hand it over to Beth Rada, who's going to talk to us about environmental issues. Go for it, Beth.
Hi, everyone. I'm the caboose, and I'm going to speak real quick so you can get your questions in. We're supporting legislation that we've supported before. The packaging legislation, Packaging Reduction and Recycling Act, is something that has been evolving over time. And the hope at first was it going to be 50% over a short period of time. Now it's 30%. I'm calling it a phase because I'm not even going to assign a time frame to it necessarily. But the goal of it is to reduce packaging by 30% and then make the remaining packaging recyclable, reduce certain toxins, what we know as in some measure as forever chemicals, make the producers responsible for reimbursing municipalities for and taxpayers, I suppose, for the collection and processing materials. It would prohibit incineration and quote unquote chemical recycling from counting as recycling. There is an oversight council. The penalties, I saw now it's $1,000 a day. I'm not sure, frankly, for deep pockets, whether or not it's going to be, a burden, a slap on the wrist, but this is what's here. I understand from my assemblyman that this is going to pass. That's the thinking. And that I think if all of us go into stores, we can notice the manufacturers are changing packaging anyway, which is a good thing. But so that's that bill. The Better Bottle bill is something that I'm sure everybody here knows the League of Women Voters was involved in passing in the early 80s. And this bill expands the types of beverages covered, and it increases the deposit from 5 to 10 cents per container. We are woefully neglecting the recycling. And so the idea is that this will incentivize more people to recycle. The third bill, which we're supporting, it's the second year of its life, the climate education bill. There may be some more hope now because I think there's some money put into the budget that would amend the education law. It doesn't create a curricula per se, but it would require that climate change and sustainability education would be taught in elementary and high schools to educate pupils about how human activities cause climate change, the effects of climate change, the dangers associated with climate change, and preventative measures that could be taken to alleviate the impacts of climate change. And schools would be, I think, sprinkling this into the various courses that they teach. That's all I have to say. So now you've got time for Q&A.
Thanks, Beth. Ooh, 8 minutes to spare. Okay. All right, folks, I've been trying to answer some questions in the chat as they've come in here. Any other questions? Oh, go ahead, Bob.
Hi, so I'm a constituent of Kerry Warner, and there are people working to ask her to support the PRRIA, Plastic Reduction Act. Apparently, she has co-sponsored a similar bill, which is weaker. I'm sorry, I don't have the name of it or number in front of me. So I'm just asking a general question about Kerry Warner's impact in the state. I've heard that
If you're asking me, I'm not familiar. I'm not
Okay,
familiar
you don't
with
have
her
anything.
bill.
Okay. Anybody else have an idea about Kerry Warner and her impact across the state?
That's a great question. She has introduced this another bill around packaging reduction that is different than the one that we are proposing. And I believe that I think maybe even I've talked with her about them both before. And I don't think that she is very interested in getting onto the one that we do support. In terms of Assemblymember Warner's impact throughout the state, she's not, I mean, when you look at who our legislative leaders are or who like chairs of committees are, not currently a legislative leader, and I don't believe she's the current chair of a committee. So her impact is lessened in that way, just solely because those are
Okay.
So she's the
some
chair
of
of
the
racing and
drivers.
wagering.
Okay. We never interact with the racing and wagering.
Yeah.
So I did not know that.
But you know, this bill that we're supporting, Peter Harcum, who chairs the Environmental Committee, is the sponsor of the bill.
Right.
And, you know, it's been around for a while. And frankly, as the issue specialist, I haven't loved every aspect of this bill. You know, there is some question about whether or not, you know, what we're calling forever chemicals can actually, whether or not it's possible or if it's properly funded sufficiently to determine whether or not the forever chemicals are being removed from the packaging. So that, you know, that's one issue. We've got to be able to enforce these laws. One thing I get concerned about is that we give ourselves a false sense of security when we pass some of these bills if they're not going to get enforced on the back end.
Right.
And the other thing has to do with the penalties. People have to, you know, take it seriously. But I would think in terms of momentum with Peter Harcum, you know, behind this bill, the idea I get is that this bill, and I don't know about the Better Bottle bill, Erica, and try to say that 10 times fast. But do you know whether or not the Better Bottle bill is likely to get passed?
The Better Bottle bill is always up against big, in similar ways to the packaging reduction bill, it's up against big environmental, what's the word I'm looking for?
Polluters.
Polluters, yeah.
There you go.
Yeah.
Cut to the chase.
Yeah, exactly. And so it's taken us, you know, it took us a long time to pass the bill in the 80s, took us a long time to pass the water bottle expansion of the bill in 2008. And I think it's going to take some time to pass this one. It really is a boon, like a financial and fiscal boon to the state in terms of the income that it could generate. And so, you know, theoretically, we would see it passed in the budget. I haven't gotten the sense that we're going to see it in the budget this year, but I'll pass it to Kim. I know Kim is looped into this world.
Yeah. The bigger, better bottle bill. I mean, part of the problem there, some of the pushback is that industry, especially the companies that actually make the bottles, actually make money off of people not returning bottles. So by increasing the amount of money that you would have for a deposit, you're going to get more people returning bottles, and that is less beneficial to the like Pepsi and Coca-Cola, basically. The packaging reduction, for some reason, I don't know why, but the paper industry is opposed to it, and I'm not sure I understand why. I think it's got something to do with the toxic chemicals, but that doesn't really make sense because in the packaging reduction bill, only toxins which are added to the recycling process are included in the bill, not ones that are officially in there before it starts. So I don't know why why paper industry is opposed to this. I'm really not sure. And here in New York State, we really don't make white paper as much anymore. We make recycled paper for packaging. So I still don't have an answer to that. But The other question I had for people is, not to be partisan, but is anyone who are trying to make appointments with their legislators, do they have any Republican legislators that are actually getting successfully being able to make appointments with them? Because I have not been successful. Yeah, Judith.
Hey, with two.
You really?
Yes.
Awesome. That's excellent.
One
I
of
was
them
just curious
to
if other
argue with
people.
me. Last year, he kidnapped me for 2.5 hours as I told him on every bill he brought up that he was wrong. And the other is brand new and trying to make a good impression.
Okay. All right.
In
All right. Well,
Saratoga,
that's good to know.
Saratoga, we have appointments with the staff of one Republican senator and one Republican, well, Carrie Warner. I mean, she's a Democrat. Mary Beth Walsh.
Yeah. We also have a few, we've set up a bunch of, local leagues have set up a number of meetings. We've got local leagues that have set up meetings from Albany County, Cortland, New York City, Long Island, Saratoga, and the Mid-Hudson, Rockland County area, not Mid-Hudson. But if you do not have meetings set up, do not fret. We will plug folks who are not identified with one of these counties into a bunch of the partner meetings that we've got set up with the BIPOC Democracy Table. And so you will get all that information over the weekend, and we'll have a chance to prep for those meetings. But we've got a lot of meetings set up. I think we're going to touch a number of offices. Laura, can you share who's already set up meetings with who, as well as those attending? Yeah, so if you are, so that's another thing I'm going to do this weekend. If you are a member in one of these counties that has meetings set up, I'll send out a note to you saying your league has set up these meetings. Would you like to attend these meetings? Or I might ask if you want to be pulled into some of the other meetings that we have set up. It's great to go to a meeting where you're a constituent, but it's also just great to go to a meeting where you're showing up and assembly members and senators are seeing that there's a lot of support for this. So I think I actually haven't counted how many meetings we have set up for Tuesday, but I will, because it's we're going to be talking to a lot of people. So keep your eyes peeled for more information to be coming. Thank you all so much for taking the time on this Friday evening to join us here. I put my email in the chat. It's just erica@lwvny. So if you have any questions, feel free to email me. And thank you all so much. I'm really looking forward to seeing you next week. Enjoy the weekend and expect to hear from me. Goodbye.
Thank you.